So ketamine is a dissociative anesthetic that we use for multiple different purposes in the pre-hospital setting. It has different effects at different dosages. So you'll see in your pharmacology manual, you have some set fixed dosages like 5 to 20 milligrams for adults, which is fine. I'm also going to give you the option of some weight-based dosing that is also widely accepted. So at the lower doses, 0.1 to 0.3 mg per kg, this is our analgesic dose for ketamine. It is not meant to fully dissociate the patient. It is just meant to address pain. Also works really well in conjunction with opioids like fentanyl. At higher doses, 1 to 2 mg per kg IV, at this point it is a dissociative, and we are only using this for things like RSI or to sedate someone who is in an extreme delirium, who is posing a safety risk to themselves or others. So at those doses, the patient is going to be completely sedate, completely dissociated, and in la-la land. In that in-between dose, that's where we can have some concerns with some psychological effects and hallucinations, but that can even happen at lower doses as well. So it's good to prepare patients for those effects ahead of the time if they are conscious and alert at the time of administration. As far as indications, we already talked about a couple. So pain management for sure, an induction agent for RSI, a sedative for post-intubation sedation. It is now even starting to be used occasionally for asthmatics because it has bronchodilatory effects as well as epileptic effects for patients with refractory seizures. So ketamine is known to sometimes increase blood pressure or heart rate after administration, which absolutely can happen. But any sedative has the potential to decrease blood pressure with administration. So we always have to be ready for that effect, especially in high doses, but you may see a transient spike in heart rate and blood pressure. It's a common myth now that ketamine increases ICP. We used to think that was a side effect, but that has been shown to not be the case. So this is safe to be delivered in head injured patients in the case of like RSI. Can certainly be given to kids as well. If we're using it for conscious sedation in the case of like excited delirium, we must monitor these patients' end tidal and oxygenation after the fact. So if ketamine is given too quickly or in too high of doses, even IM, it is possible for these patients to have apneic periods. So we need to make sure that we catch that.